Hi, Dr. Anitha Kunnaiah, Senior Consultant Laparoscopic Robotic Surgeon from Yashoda High-Tech Hospital. Today we will be discussing a common known problem, ovarian cyst. A cyst in the ovary is a general term, but it doesn't always mean it's a problematic, and all cyst in the ovary doesn't require immediate surgical interventions or treatment. Ovarian cyst is nothing but a fluid-filled cavity which forms inside the ovary. We have simple cyst, hemorrhagic cyst, follicular cyst, complex cyst, and last category is a complex cyst suspicious of any kinds of atypical cells or cancerous changes cyst. Commonly we see most of our patients coming with us with a report, ultrasound report stating that I have a cyst in the ovary, and they will be very panicked with these reports. But we should see, what are the points we should see when we see a report with an ultrasound stating there is a cyst in the ovary. Cyst in the ovary doesn't mean always a pathological, as I told you. Coming to the age of the patient, what symptoms she is coming up with, and what is the ultrasound report telling you about the cyst characteristics. Simple cyst is a cyst which normally has only a clear fluid filled and usually a single locule filled with the fluid. And these cysts often 3 to 6 centimeters in size. If they are larger than 6 centimeters, they are causing problem, then they have to be handled. Hemorrhagic cyst is a cyst which has blood inside the cyst. These cysts again are naturally, they resolve on themselves, or sometimes you may require some small treatment to dissolve them. Dermoid cyst. Dermoid cysts are a pathological cyst which has formed by the layer of the epithelium of the ovary. These cysts are definitely not to be considered lightly, but however, if the dermoid cyst, which usually has some kind of sebum material, hair follicles and fluid inside, so it is a mixed category in this, and these cysts, if they are really big enough, more than 6 centimeters, what are these chocolate or hemorrhagic cysts? Normally, the inner layer of the uterus, which is called as the endometrium, sometimes can have a retrograde reflex, due to which a small part of these glands can enter the pelvic cavity, that is abdominal wall inside, through the tubes. And they get implanted on the ovaries and whatever the spaces is available, and forming a cyst called as a chocolate cyst. With these menstrual blood collection, it changes into a chocolate material and causes the name of it called as chocolate cyst. So these cysts also to be looked into. Complex cyst is nothing but they don't fit into any categories of we have explained you now. So there will be a cyst with lot of different multiple locules, there will be thickening of the cyst wall, there will be altered content inside, sometimes there will be very solid component inside. These cysts has to be evaluated immediately and looked into with other mode of imaging and taken a call accordingly. Commonly they come up with incidental finding while doing the ultrasound scan stating that there is a cyst in the ovary. Second common is a vague pain in the abdomen, especially during the mid-cycle of the pain or sometimes persisting longer pain. Few of the patient comes with irregular periods. Few of the patients can come with a cyst which is there for a longer time, which is not resolving or dissolving even after treatment or therapy. The fourth category of symptoms coming with severe painful periods and a big cyst which is persisting. Commonly we see painful periods with a cyst called as a chocolate cyst. And some of them can come with acute emergencies of these cysts going in for a torsion, like vomiting and pain abdomen and severe not relieving pain, which becomes an emergency for us to take a call with.